Thank you so much, Etsy. Well, hopefully you can hear me okay. I appreciate the introduction. And as you've mentioned, on behalf of Monica and the 10 grantees who co-produced this paper, I will be presenting today the synthesis review on mobilizing women as agents of change to prevent violence against women. Even before we get started engaging with the findings today, the review really invites us to reflect on what does mobilizing women mean for this sample of civil society organizations and why it matters. The UN Trust Fund projects mobilize women to become agents of change in their own lives in multiple ways. But one of the most used approaches was to identify, recruit, and mentor an intermediary cadre of women who led the mobilization of women in their communities towards social change. For the purposes of this brief, intermediate cadre of women are referred to quite often with a catch-all term, community facilitators. And because they are a crucial link between VAWG prevention projects and the broader community of women that they want to engage. This is not the only way they are being mobilized, but this is one of the many ways that they are being mobilized. You may be interested to know or understand why this cadre of women matters. According to the grantee organizations engaged in this brief, they matter a lot, and they matter for 4 crucial reasons. First, they are critical for breaking the silence on violence, which is a crucial step towards prevention. Second, they make projects more demand-driven. Third, they're able to reach the most vulnerable women and girls. And fourth, they allow projects to shift the burden of change from any one individual to collective action. Therefore, this brief focuses on civil society organizations and practitioners who have mobilized women to become agents of change by creating a cadre of community facilitators. It sheds light on their practice of how they facilitated, supported, and sustained these efforts. The methodological approach combines a desk review of monitoring and evaluation reports, as well as focus group discussions with project staff from 10 diverse civil society organizations that engaged community facilitators through their project strategies. Through a qualitative and inductive approach, practice-based insights from these 10 case studies were put into conversation with existing literature to highlight how learning from practice can contribute practical lessons on evidence, lessons to the evidence base, I should say, on VAWG prevention, and fill knowledge gaps. In this case, with regards to the engagement of community facilitators who are not project staff, but often work on a voluntary basis with women and girls with whom they share a social, environmental, or behavioral or occupational experience, and with whom they are trusted. The 10 organizations whose practice-based knowledge was central to this brief are the following: Women's Justice Initiative in Guatemala, Alliance Against LGBT Discrimination in Albania, European Center for Minority Issues in Kosovo, Red Nacional de Promoción de la Mujer in Peru, War Child Canada in Jordan, Free Yazidi Foundation in Iraq, The Story Kitchen in Nepal, Equality for Growth in Tanzania, Initiative pour la Protection des Droits des Femmes in Morocco, and finally, the Institute for Development and Community Health in Vietnam. We are so very grateful for their time and contributions to this brief, and look forward to hearing from a couple of them after this presentation. So how did these CSOs mobilize women? From the reports, interviews, and focus group discussions, it seems that the following conceptual framework really helped us kind of understand how projects designed and implemented mobilization activities over 3 dimensions. It's developed by Campbell and Manel. And those dimensions are over time, across space, and through networks. Each of the 3 dimensions provides learning and insights into the processes that led to a shift among women from being beneficiaries of projects to authors of their own narratives and agents of change for others. In the remaining presentation, we'll go over how each of these 3 aspects are critical. So first, time. This dimension is key for prevention projects working to enhance women's agency. Because the UN Trust Fund projects in this case study were funded over the span of 2 to 3 years, it is important to consider what is possible in that time frame and what activities make a difference. All projects began with a process of reflection that raises self-confidence and self-efficacy and works incrementally to increase women's agency over time. However, some shifts in women's attitudes and behaviors because of mobilization efforts are not always linear. It's not that one goes from being not empowered to empowered. It's more of a back and forth, a trial and error, and change does occur quite sporadically. But it does stand out in the brief that women can be mobilized within a time frame of 2 to 3 years. We will hear from Free shortly on how they did this with Harikara, who gave women refugees tools and resources to enable them within a short time frame to become authors of their own narratives. And this was within the context of extreme circumstances. So it's not without its challenges. And we will come to that a little bit more shortly. The second dimension through which projects mobilized women as agents of change and efforts to prevent violence was through the creation of safe spaces. This notion of space came up prominently in 5 ways: creating a physical space, creating safe spaces for contemplation, creating safe spaces for paying attention to language, making VAWG a safe topic, and identifying safe persons. Creating a physical safe space has to do with the separation of space that women may not have had access to before. So several projects had a physical location, project offices, skills training centers, vocational training centers, or women's shelters where women felt safe to gather. So spaces were safest when they were accessible to the women and acceptable to their families. Such spaces are critical to community facilitators' transformation from beneficiaries to actors. On creating spaces for contemplation, it was found that projects got creative when they were unable to offer permanent physical space by offering temporary safe spaces. For example, the Story Kitchens project in Nepal held storytelling workshops where community facilitators were survivors of the community's civil war, became change agents by interviewing women like themselves about their experiences of violence, offering them a chance to reclaim their dignity and become authors of their own narratives to break the cycle of intergenerational violence. The Story Kitchen conceived of such spaces as not only safe spaces, but also brave spaces. The third aspect of creating safe spaces has to do with paying attention to language. Many projects worked in multilingual contexts where the native languages of the most vulnerable were not the official or dominant language. Being able to speak in the dominant language opens doors and creates possibilities. Conversely, an inability to create and communicate in the dominant language creates feelings of alienation and disempowerment, which thwarts the ability of women to seek justice. 2 projects in Latin America and the Caribbean, WJI in Guatemala and RNPN in Peru, worked with Indigenous women who felt powerless in spaces of authority, for example, in healthcare settings, courts, and police stations, because of an inability or a hesitancy to speak Spanish. By conducting trainings and other activities with women in their native languages, Cachiquel in Guatemala and Quechua in Peru, the projects created a safe space where community facilitators learned about their rights and discussed how to approach local health and legal authorities to bring an end to violence. The final 2 aspects of space that practitioners spoke about had to do with making violence a safe topic for discussion and creating safe persons in the community who became confidants. As WJI shared, and I'll read this quote, "Sometimes you cannot imagine the spaces where women find us and tell us their problems. It can be in the community washing area or in any other space. This is when we take advantage of this opportunity to tell the woman that she has rights, that she deserves to live a life without violence, and that she can seek help and support. Another dimension through which projects mobilized women to become agents of change was by widening women's social networks, both their interpersonal networks and their networks with an array of institutional actors that women came in contact with. On interpersonal networks, all 10 projects enabled women to become acquainted with each other over time, develop bonds of friendship and mutual support for sharing problems, finding solutions, and engaging collectively in the intervention as well as in leisure activities. On networks with institutional actors, this was really critical for the project. Community facilitators witnessed a significant shift in their self-confidence, and other project participants benefited by having an anchor in the community who could speak on their behalf with powerful institutional actors. Through this, projects gained by having a cadre of women committed to ensuring implementation of violence prevention activities. These were the main takeaways that that came out when it comes to time, space, and networks. And we sincerely invite you to read the brief for more insights on how these were actioned by different CSOs. This work is often extremely challenging though, and practitioners highlighted 3 challenges that came up over and over across the 10 projects. First, on the recruitment of facilitators, community facilitators. Recruitment challenges occur when it's not clear from the outset how projects can be beneficial to the lives of the proposed participants. Some projects chose to compensate community facilitators for their time, some did not, but they found that either way, it was important to make the benefits and risks clear from the outset of their engagement. Second, on retention of community facilitators. Retaining community facilitators can be challenging. They may face re-traumatization, burnout, or being overburdened by the work itself. All projects took several steps to prevent this. For example, ECNIC in Kosovo stopped doing home visits to protect community facilitators from burnout and potentially violent situations, established psychosocial support systems, and increased compensation for them. Community facilitators may also feel that they are not engaging with their peers in a meaningful way and lose interest when participants do not respond to outreach. So when community facilitators were engaging project participants in more than one way, IBDF in Morocco, for example, set up community support activities in the neighborhoods themselves, rotating childcare and recreational activities around mobilizing women to work on local issues relevant to their daily lives. So when their goals are designed to respond to women's needs, then they are more invested. Third, on sustainability of project results. For all 10 projects, the results were sustained beyond the UN Trust Fund project, and they were sustained in 3 critical ways. A, project's approach of using women community facilitators was recognized by donors, which was something that enabled them to secure further funding. B, projects continued to support the networks formed during the grant period to scale up. And C, project results were institutionalized within their national context, where it was found that projects really aimed to leave something behind, a sort of crack in the patriarchal order. However, there are challenges in sustaining mobilization efforts. Although community facilitators thought they had learned valuable skills, they were not certain that they could work without the project's support. A few project evaluations point to this, with conclusions around the hand-holding period, suggesting that it may not be adequate enough and recommend creating more sustained mentorship. Finally, as we come to the end of this presentation, it is important to reflect on the current moment and what it means to have mobilization activities during the COVID-19 pandemic. In response to the pandemic and rising rates of VAWG, projects were able to draw on active cadre of women community facilitators and change agents who were critical because they were not outsiders in the community and not viewed with suspicion. They were known and trusted. They were engaged with the project. They had built networks with the broader community of women, and in some cases with institutional actors already. When mobilized by projects, they played an effective leadership role on behalf of their peers and communities during the pandemic and did their best to ensure that help and support was available, particularly for those experiencing violence. And other projects worked with community facilitators to conduct critical advocacy in a time of need. Therefore, creating, mentoring, and supporting this cadre effectively becomes important in a time of crisis as well. And I'm sure we will hear more about this from our CSO partners in our discussion. Before wrapping up, we conclude by summarizing a set of recommendations which are offered from the CSO's practice-based knowledge directly to practitioners, donors, and the research community. Recommendations for practitioners include: make women's agency part of the theory of change, co-create projects, especially with marginalized women, ensure a mix of bottom-up and top-down approaches with a pre-implementation strategy that considers a few key questions related to skills development for women community facilitators, compensation of participants, and strategies to mitigate risk of low participation, as well as risks of harm, for example, re-traumatization. Create safe spaces for women to meet and collectively organize, paying close attention to safety in physical and online spaces and the languages used in these spaces. Consider ways to make project participants more visible in places of authority, including through intermediary organizations, so that they become advocates for themselves, but with careful consideration of the institutional context, the readiness of participants to engage, and the ability of projects to support and mentor the women through the process. Consider intervention strategies that take into account the continuum of violence that women experience across multiple settings. Recommendations for donors include: consider funding projects for a longer duration, as mobilization strategies and sustaining them require a lengthy timeframe for implementation. Develop guidelines on paying an honorarium, a stipend, or salary to community facilitators after, of course, careful discussion of the pros and cons of this. Develop minimum standards on what it means to be participatory, because local interpretations can vary from information sharing to consultation and co-creation. Support the participation of women agents of change in high visibility events organized at local, regional, and global levels. And this should include both online and in-person fora. Require projects to dedicate resources to self-care strategies. Finally, the recommendations for researchers include: invest in process evaluations as well as impact evaluations to assess how a program outcome or output was achieved, especially when it comes to enhancing women's agency. Conduct more research on having a cadre of women facilitators as a mobilization strategy to help donors and practitioners to develop a sound, evidence-based policy around this work. With that, this part of the presentation and roundtable is concluded, and I'm so very thankful for your attention. On behalf of Monica Biardavalu, we really hope that you would engage with this brief. Thank you so much.